This is a presentation that is a component of Medical Terminology Illuminations Clinical Sense and Sensitivity series. This presentation is in full. It is self-evident that this illumination by Jacob Jordaens calls our attention on the tongue. The term tongue is related to a likewise sounding word in English tongue, which is a pincer, which is an instrument to grasp. The tongue in our oral cavity grasps the food to push it toward the esophagus. The Greek root for tongue is glossa, like glossary. We speak with the tongue, glossitis. We can get inflammation of the tongue. And in Latin, the root is lingua, from which we talk with the tongue, so we get language, and anything that looks like a tongue we call lingula. But in addition, this is not the sole sign. There's a little bit too many folds here. Maybe there is adiposity. This is a hefty baby. Look at the facial proportion. He certainly doesn't have a problem in his weight. So this image clearly shows this proportion in the face in terms of tongue and the surrounding structures. Likewise, the folds under the skin showing that there is too much deposit of adipose tissue. This morphogenesis, the morphogenesis here is disrupted, so it is a dysmorphic sign. So pre and postscripts like aglossia, ankyloglossia, microglossia, macroglossia, hemiglossia, hemihypertrophy of the tongue, agenesis, cleft, cysts, hypoplasia, teratoma, and tumor of the tongue are examples of terms that a clinician will need to understand and use. I think this instance obviously is macroglossia. Immature or superficial clinicians tend to, let's say, shoot from the hip, as they say in America. They have one sign and they shoot and they say, I know what it means. Single signs rarely mean much. One has to know much more before we can construct a veritable medical signal. So what is the signal of this macroglossia? We need to examine the rest of the child. He sort of looks big. And a wise clinician, a compulsive one, will notice that this child has an omphalocele and in general looks sort of excessively large for his age, perhaps indicative of an overgrowth situation. So this clinician may then test the waters of the signal, putting together macroglossia with omphalocele and large growth. He raises the question that the concurrence of both could be indicative of a syndrome. Two things running together, both relatively rare, so why should they be concurrent? And because this clinician considers that the rarity of this combination of signs warrants a review, because he doesn't know immediately what this may be, so he goes and reviews the medical knowledge, the casuistics, the books, or whatever other encyclopedias he may have access to. So, as a wise clinician, he searches what's known about it, what was the experience of other clinicians, and lands on our website, Clinical Eye Openers, enters macroglossia, and what he finds is a panel of illustrations shown here. But in addition to macroglossia, he also finds the combination or concurrence of macroglossia with omphalocele, finds evidence that in some of the patients the growth or hypertrophy of the tongue continued as they aged, And to his surprise, he finds quite a few illustrations of the ears and wasn't sure what to make out of it. Casuistics is essentially the reporting of clinical observations, whether we understand or don't understand causes, mechanisms, etc. It is the reality the way we or someone else have seen. There is hostility in the medical academia for case reports because nobody wants to say I'm an ignorant. But without casuistics, we cannot develop nosology. What is nosology? Noxa. We need to know about the nature of disease. And the nature of disease is constructed on the basis of reality, which is then on the basis of case medicine. Another difficulty is that when somebody sees a dysmorphic sign, then the literature speaks of major and minor, significant, insignificant, and variable, and whatever have you. That's not the point. The point is a sign a signal? Does it have information value? If you are blind, you see nothing. Many physicians are not comfortable examining the ear, so they don't write anything about it. So let me tell you, this is the helix. This is the tragus and antitragus. This is again the helix and the antihelix, and this is the lobule. And if this clinician didn't look at it, so you may as well erase it. But he did, and he noticed that there are ridges in here, and there are pits and grooves, and a ridge, and a ridge, and a pit, and a pit. That is a sign. It's unusual. But he doesn't know what the signal is. So he has to find knowledge, and he will find knowledge in nosology. And nosology tells our clinician that this is a very valuable sign. It is a signal of cancer risk. And why is it important? Because it's life saving. This baby may not have the cancer yet. Those cancers appear after the age of 1 or so until to some limited age, 7 or 8. It is important to know the natural history of this particular disorder in order to fully understand the cancer risk and how to prevent it. So there we go. Casuistics, building nosology, nosology, building diagnosis, and the whole preventive medicine strategy, not only treatment. So the hypothesis of this clinician is correct. His patient has a syndrome of gigantism. The patient that he observed did not manifest differences right to left, so didn't have hypertrophy. He palpated the abdomen, felt an enlarged liver, so it had a visceromegaly. He obviously had macroglossia and exophalo-or-omphalocele. And then he didn't measure the blood sugar initially, but later on found that it was unstable and that the patient needed to be watched for hypoglycemia. He found that all those findings were already reported by Beckwith in 1964 and by Wiedemann in 64, and that the evidence of high cancer risk Wilms tumor accumulated since 1964 to be beyond dispute. Also, that the signs on the ear, that is the helix and pits and the lobules irregularity, was a major sign that signaled high cancer risk in newborns that may or may not have had omphalocele. And nothing in medicine is static, science progresses. Any high cancer risk syndrome calls attention to molecular geneticists who are hunting for which genes are responsible for such high risk. And eventually, through the study of many, many families, they were able to pinpoint the region of chromosome 11 on the short arm, or P, in location 15.5, where they discovered that there's a DNA sequence that is a functional gene they called IC1 and IC2. And they found that 10 to 15% of patients with this kind of a syndrome had mutations at this site. This has two major implications. This finding confirms the diagnosis in about 10 to 15% of people, meaning that there is another cause for it. And the second point is that it confirms the diagnosis. And the third point? Oh, well, the third point is very important. People that have this mutation will pass the mutation to half of their children, and they should try not to do so. So they need to be tested. So even if you're sure of the diagnosis, you should be testing those patients for the benefit of their future children. Well, are we done with tongue, glossa, or lingua? Well, I don't think so. Here we have another patient with a tongue that is anchored, ankyra in Greek, to the palate. It won't come down. Is stiff there, is stuck. It's also distorted. An anchor is crooked, so is this tongue. Ankylo, that's what it means, this prefix to glossia, a sign. And I said one sign doesn't mean much. So how do we make a signal out of this sign? Signal of what? Something went wrong. What did go wrong? And the clinician, being an excellent one, starts looking for other trouble, and it doesn't take much to notice that there are 3 fingers that didn't develop and 2 that are maldeveloped. This is called in clinical medicine ectrodactyly, ectro meaning missing. Well, we have something fairly rare here and fairly rare here, and they are concurrent. So is this combination of 2 signs a signal? But then of what? Lazy physicians will write 2 anomalies of unknown cause or nature. But superior physicians will go into casuistics and check in the literature who else saw this. And our clinician didn't find much. So does that mean that this doesn't exist? Does that mean that this is not a syndrome? Well, not at all. Somebody has to be first, doesn't it? One observation, such as ankyloglossia with ectrodactyly, is indeed a private observation. But is it a syndrome that applies to other human beings? And our clinician had difficulty finding reports of this kind. But he did saw reports that experimental hyperthermia in animals induced oral and limb defects. And that was just about all what he could find. This prompted him to talk to the mother again and ask her, did you take hot baths or did you have fever while you were pregnant? And the mother said, oh, yes, I did tell you because I didn't think you were interested in this, but I love to take very hot baths and go to the sauna. I did not have any infections or fever, but several times a week I do immerse myself in hot water. And so this created a dilemma for this clinician. He wasn't sure if this was a veritable connection of cause and effect, but he decided to submit it, to do a case report. Somebody has to be the first. And that is when the reactions to his report were such that today hyperthermia is considered a potential teratogen of humans. As indicated earlier, the contents of these short videos are extracted from our website. And should you visit one of the companion websites, one of several, but this one in particular, Pandora Word Box, you may find that there are several ways you can expand your understanding and find further explanations. For instance, should you visit Pandora Word Box, you can look for short definitions, nomenclature, glossary, and you're going to find one. Should you like to know where it comes from, where do these tongue as an instrument of grasp, of pincer, or tongue, biologically, the one who pinches the food, that grasps the food and pushes it toward your esophagus? Or should you know more about a constellation of related words like glossa, glossary, and glutton, and gory, and gorgon? You will find this in an overview. Or you could then go to an illumination, which is a galaxy of words that impact each other. Stars around a galaxy influence each other, and I will show you that next. So here is an abstract drawing of a galaxy, the stars being words. The ideas of these words impact each other. Let's illuminate them. So once we visit Pandora Illuminations, we are going to see an array of icons to choose a particular illumination. In this case, we'll click on tongue. So let's click on tongue, and the illumination starts right away, and is going to orient us to the contents that potentiate, that enhance each other. Each of these terms is like a star in a galaxy. They influence each other, and the more you know about each of them, the more you know about the whole perspective and vice versa. So as the heading says, these are clickable notions that link these words. So let's start by clicking on tongue. And if we click on tongue, then we end up in Pandora word box and an image of MACROGLOSSIA. And from there, we can explore the whole array of contents in Pandora, including this one. But we could search for MACROGLOSSIA. You see above, there is a search box. So let's search there for glossia, glossa, Glossa. And then that will give us the whole content of Pandora that includes the notion of glossa. And you could see, and you can choose, and you can travel short, long, or medium distances. So let's go back. And if we click on glossa specifically now, let's click on glossa, we're going to end up on an overview about tongue, because glossa means tongue. You could see above there glossa, glossary, glottis, and so on. These are subjects that this overview will try to tie in together and illustrate with proper images. And you could see that glossa, or the tongue, has something to do with swallowing, with tasting wine, or having too much alcohol, with vomiting, so is safely done and not ends up in your lungs. By the way, that's a cause of death in many of those that are vomiting due to narcotics. Now we can go back, and another term for tongue, and this time instead of Greek Latin, is lingua, or language. Let's see, lingua and lingua and lingula. Lingula is anything that has the shape of a tongue, and we see here linguistics, lingula, and so on. And you can read about specifically, narrowly, but in depth, where is this term coming from? Where is the syntax, mythology, pathology, phonology, whatever you like. If you are inclined or have such tendencies, you will find this perhaps rewarding. Let's go back. And then we can click on macroglossia. And we already saw the first image. But here is a whole gallery, and I think that that would give you a greater depth or detail from the clinical perspective. And you are now on a different website. It's called Clinical Eye Openers. If we go up, you have a full access to the contents of this very large, highly illustrated, encyclopedic clinical eye openers effort. But many contents require membership. There are some sensitive pictures, and you can imagine that this cannot be widely open to anyone anywhere in the world. So if you find that you cannot get somewhere, then subscribe. Let's go on. Let's go back. Ankyloglossia introduces another prefix to glossia. Ankylo, like your ankle, is something that is distorted, is crooked. In my mind, at least, ankylo also means stiff. And here you have an example of a fairly common characteristic among children, which is the tied tongue or the tongue tie, which is a frenulum, something that holds the tongue from moving up. But there are other types of ankyloglossia, which we have shown in the illumination that deals with the subject. Let's go back. And there is one more word here that we can explore: hypertrophy. The tongue can become enlarged. This individual is a dwarf and has a particular face or facies, and with aging, his tongue got larger. He may have a metabolic inborn error of metabolism, where perhaps some of the chemicals that the body cannot digest accumulate in his tongue. Could it be? I don't know. But there are storage diseases that are manifested by a gradually enlarging tongue. Some individuals with lack of thyroid function will also develop a larger tongue. So enlargement or macroglossia of tongue is not necessarily congenital. Let's go back. And so we can explore all sorts of illuminations, and they are at your disposal, at your fingertip. I hope you visit Illuminations soon, and until then, we shall continue with this program. Thank you for your attention. I find it necessary to underscore the importance of our presentations that we call clinical eye openers because they are related to very important perspectives. Here are three steps: A, B, and C. The first step was clinicians who recognized the signs and signals and synthesized the syndrome and the diagnosis of Beckwith-Wiedemann syndrome or macroglossia omphalocele syndrome. They recognize the high cancer risk nature, and then they fostered cytogenetic studies that eventually became the step B, a focus on a specific area of chromosome 11 short arms position 15.1. That led about a decade later to studies of epigenetics, which are very complex, but in essence, epigenetic concerns those factors that are not genomic in nature but control the expression of genes, ultimately, the loss or gain of function. That's the fate of being normal or being abnormal, living or not living. This, in turn, also identified retrospectively a relationship of the macroglossia omphalocele syndrome with a different syndrome. This is the Russell dwarfism syndrome. Here is hyper, here is hypo, hypersomia, hyposomia, and so forth. These are very fundamentally important areas of exploration today. All our presentations concern teratology and dysmorphology because we believe that these disciplines have a role in every medical specialty. All our presentations also emphasize medical terminology through ample use of illuminations, images, for images are an international language. They emphasize clinical sense, their utility, and sensitivity or human humanities, which we find amply represented by artists in sculptures and fine paintings. The terminology we touched upon in this particular presentation are shown here, and the style in which these notions are presented can vary, and it is in the interest of brevity that I'm not going to explain these various styles, which are fully illustrated if you access our website through this link. So we have reached the end or the finish of this presentation, and I invite you to come and see us. You may find much more on these subjects and have fun, travel. Should you find yourself in Salzburg or in Amsterdam, look up these images. But I challenge you to find them. And if you can't, then visit us. We'll tell you where they are. Till very soon, please accept my best wishes. Goodbye.